My name is Melissa Goble. I'm a women's health nurse practitioner. I work here at Cuyuna Regional Medical Center in the OBGYN department. I started at CRMC in 2005. I worked as a labor and delivery nurse for about 13 years prior to getting my women's health nurse practitioner and started over in the OBGYN clinic in 2016. I practice at the Crosby Clinic and also at the Breezy Point Clinic. The Women's Health Initiative was a large randomized trial done from 1993 until 2002 when it was abruptly stopped. They were looking at hormones that prevented heart disease, breast cancer, colorectal cancer, and also osteoporotic fractures. The trial involved women who were on estrogen and also medroxyprogesterone acetate, which is a synthetic progestin. They took that each day. There was also an estrogen-only group and also a placebo or a sugar pill group. This study was done on women between the ages of 50 to 79 years old, with the majority of the women between 60 to 69 years old in the hormone group, which is a key factor to that. The Women's Health Initiative, like I said, was stopped in 2002, but they did find that postmenopausal women and the postmenopausal symptoms had an increased risk for breast cancer, heart disease, stroke, blood clots, and urinary incontinence. And those were the main reasons of why the study was stopped. Although women using combined hormone therapy had a lower risk of fractures and colorectal cancer, these benefits did not outweigh the risks. As a result, many women stopped hormone therapy, reducing their risk for breast cancer. Today, the FDA does urge women who do take hormone therapy to take the lowest helpful dose for the shortest amount of time. The study found that about 2.5% of the women in this study showed effects, meaning that over the course of a year, for every 10,000 women taking estrogen plus the progesterone or combined hormone therapy, that we would expect about 7 more women to have heart attacks opposed to those who were not taking it. About 8 more women would, out of the 10,000, would end up with strokes. 8 more women would end up with breast cancer. About 18 more women would end up with blood clots if they were taking the combined hormone therapy. But they also found that 6 fewer colorectal cancers and 5 fewer hip fractures. Newer studies have shown that the combination of estrogen plus progestin fails to protect heart and blood vessels in older women when initiated greater than 10 years out of menopause, which is also a key factor. These women had been postmenopausal for greater than 10 years. However, they do not show the definitive damage to the heart from taking the combination. There are probably some women who could take hormones safely and also benefit from hormones, particularly women who have been closer to the age of menopause, meaning less than 10 years out from menopause. Estrogen therapy alone, however, is still being tested in healthy women without a uterus, which showed no effect. Hormone therapy is not recommended if you have had a history of a heart attack, stroke, or stroke-like symptoms, or if you have developed any blood clot. Newer studies also have shown that women receiving hormone replacement therapy early after menopause had a significantly reduced risk of mortality, heart failure, and myocardial infarction. Again, this is information for women out there about the Women's Health Initiative and hormone replacement therapy, so please do not panic or abruptly discontinue your hormones if you are currently taking them. We recommend that you talk with your healthcare provider about the individual health risk profile and the hormones you are currently taking. Stopping abruptly may cause a reoccurrence of menopausal symptoms such as hot flashes, night sweats, even if you did not have those prior to taking the hormones. If you would like to stop taking hormones, it is better that you taper off gradually compared to abruptly stopping. And it is also possible that the benefits could exceed the risks for you, or that there are alternative forms of hormone replacement therapy such as a patch versus pills, lifestyle changes, or medications that you can take to lower your health risks. Discuss your goals for therapy carefully with your doctor. Taking hormone replacement therapy is a decision that women need to make on their own and with their healthcare provider, and it is individualized per each woman. When women come in, we do consult them as far as, in regards to hormone therapy. We ask about their background, their history, take an intake, what are their symptoms, because it is very effective when treating hot flashes and night sweats. If they have any symptoms, and then also we look at, is it a patch better than a pill? We have a discussion with women, and depending on if they are still having a regular menstrual cycle or not, depends on if they were able to go on hormone replacement therapy or not. Most of the women, it is individualized too, but they have already went through menopause or are transitioning through menopause. There are many options out there for women who are suffering from hot flashes and night sweats, and no, they do not need to suffer out there anymore, because there are so many options that are hormonal and non-hormonal. Women are able to make an appointment directly to consult with an OBGYN. They do not need a referral from their family provider.